Before watching this video, don't forget to subscribe to our channel by clicking the subscribe button below and click in the bell icon.
How to improve your health with spirulina. Spirulina are blue-green algae that are also known as cyanobacteria. Spirulina actually comes from two species of algae, Arthrospira platensis and Arthrospira maxima. Spirulina is a great food because it is high in protein, antioxidants, vitamins, minerals, and a variety of other essential components necessary for good health. Because of this, spirulina is often taken in powder or tablet form as a nutritional supplement and weight loss aid. Method number 1: using spirulina as a nutritional aid. Step number 1: add spirulina to a meal to increase its amount of protein. Spirulina is a complete protein. This means that it contains all the amino acids needed by humans to make more protein. Step number 2: take spirulina to increase your vitamin intake. Spirulina contains a wide variety of vitamins. These include B vitamins. Spirulina is particularly high in thiamine and riboflavin, and contains all the B vitamins except vitamin B12. Spirulina contains a substance similar to vitamin B12 called pseudovitamin B12, which is not active in humans. Spirulina contains significant amounts of vitamins A, C, E, and K minerals. Spirulina is particularly high in copper, iron, and manganese. It also contains significant amounts of calcium, magnesium, phosphorus, potassium, sodium, zinc, and selenium. Step number 3: add spirulina to your diet to increase your antioxidants. Some of the substances found in spirulina are very effective as antioxidants. These antioxidants can limit exercise-induced muscle damage and increase endurance. Antioxidants can also decrease inflammatory markers and allergic disorders, such as hay fever, allergic rhinitis. Antioxidants can also potentially prevent pre-cancerous oral lesions from becoming cancer. Step number 4: use spirulina to decrease high blood pressure. Spirulina seems to drive the increased production of nitric oxide, a vascular dilator. This can significantly bring down high blood pressure. Higher doses of spirulina, about 1 tablespoon, 16 grams per day, appear to be needed for this kind of effect. Step number 5: add spirulina to your diet to boost your immune system. Spirulina may be useful in the treatment of viral diseases such as hepatitis C and influenza. This is because of its immune-promoting properties. Method number 2: using spirulina to lose weight. Step number 1: take spirulina daily. There are a number of benefits of spirulina both as a nutritional supplement and as an aid to weight loss. For most of these benefits, 1 to 4 grams of spirulina a day, about 1/2 tablespoon, is sufficient. Many people take spirulina in pill form. You can take approximately 4 to 6,500 milligrams pills of spirulina spread out throughout the day. Step number 2: take spirulina if you want to eat low glycemic and healthy foods. Eating these types of foods can help you to lose weight. This is why spirulina is recommended for those with diabetes. 1 cup 112 grams of spirulina contains 325 calories, with 30% of calories derived from carbohydrates, 48% from protein, and 22% from fats. 1 cup 112 grams of spirulina contains 4 grams of dietary fiber. Spirulina has also been shown to be effective in reducing blood sugar levels and the levels of A1C, a biomarker used to follow blood sugar control in people with diabetes. Step number 3: add spirulina to your diet in order to help decrease your cholesterol. This is an important goal for your health that is connected to weight loss as well. Spirulina provides nutrients that can decrease LDL cholesterol, triglycerides, and raise HDL cholesterol. This provides protection against heart disease. In addition, the antioxidants in spirulina have been shown to reduce lipid peroxidation, a marker for heart disease and fatty liver disease. Step number 4: understand that using spirulina for weight loss has not been verified as effective by the FDA. Spirulina has been promoted as a weight loss aid, but the FDA has declared that it is ineffective for weight loss. This means that nothing in the spirulina can induce weight loss. However, because spirulina has a low glycemic index, is relatively low in calories, is highly nutritious, and allows you to feel fuller for a longer periods of time. Taking 1/2–1 tablespoon 8 to 16 grams of spirulina before meals, usually about 1 hour before, can result in significant weight loss, especially when combined with increased physical activity. In fact, spirulina is used in many areas of the world to treat malnutrition. Method number 3: Learning about spirulina. Step number 1: Know the nutritional content of spirulina. This is important information to know for any supplement you want to take. 1 cup 112 grams of spirulina contains 64 grams of protein, 9 grams of fat, 0 mg cholesterol, 3 grams of saturated fat, 2.3 grams of PUFA polyunsaturated fatty acids, including 922 mg omega-3 fats and 1404 mg of omega-6 fats. 27 grams of carbohydrate. Step number 2: Be aware of the possible side effects of taking spirulina. There are theoretical possibilities that spirulina may boost the immune system and should be avoided by anyone with an autoimmune disorders, such as multiple sclerosis (MS), lupus, systemic lupus erythematosus (SLE), and rheumatoid arthritis (RA), among others. In addition, drugs which suppress the immune system interact with spirulina. These medications include azathioprine, Imuran, basiliximab, Simulect, cyclosporin, Neoral, Sandimune, daclizumab, Xenopix, Maromonab CD3, OKT3, orthoclone OKT3, mycophenolate, Cellcept, tacrolimus, FK506, Prograf, sirolimus, Rapamune, prednisone, deltasone, orezone, corticosteroids, glucocorticoids, and others. Since spirulina is a complete protein, it also contains an amino acid, phenylalanine, which may make a condition such as phenylketonuria (PKU) worse. Step number 3: Be aware that spirulina can be contaminated if it is not harvested correctly. Like other blue-green algae, spirulina can be contaminated by microcystins, which are toxic substances that people should not ingest. Spirulina can also absorb heavy metals from the environment, which you will then absorb when you eat it. To avoid taking contaminated spirulina, you should only buy it from a reputable brand. Ask at your local natural food store what brands are best and most well regarded. Method number 4: When to seek medical treatment. Step number 1: Consult with your health care provider before taking any supplement. Your doctor can tell you whether the supplement will interact with any medications you may be taking. It is also good to let your doctor know what you are taking so that they don't prescribe you a medication in the future that will interact poorly with your supplements. Talk to your doctor about your health history before taking spirulina. They may recommend against taking spirulina if you're pregnant, breastfeeding, or have a rare genetic disorder called phenylketonuria. Step number 2: Ask your doctor before taking spirulina if you have liver problems. It's possible that spirulina can cause liver damage if it's contaminated with heavy metals or microcystins. If you have liver disease, talk to your doctor before trying spirulina. Liver problems from spirulina are rare, and should not be a problem if the spirulina you take is pure and uncontaminated. Ask your doctor to recommend a high-quality supplement. Step number 3: Get medical attention if you have an allergic reaction to spirulina. For most people, spirulina doesn't cause significant side effects or bad reactions. However, in rare cases, it can cause a severe allergic reaction. Stop taking spirulina if you have symptoms of an allergic reaction, such as itching or hives, a skin rash, an upset stomach, or tingling or itching in your mouth. Call emergency services or go to the emergency room if you have severe allergy symptoms, such as swelling of your lips, face, tongue, or throat. Difficulty breathing or swallowing. Nausea or vomiting, lightheadedness, dizziness, or fainting.